Moving on to the second modality, we have apexogenesis. Now, what is the difference between apexification and apexogenesis? One difference which differentiates both is that apexogenesis is used for vital teeth. There we studied that apexification is used for non-vital teeth, right? But here apexogenesis is used for vital teeth. Now let's see what the definition says. It says it is a histological term, right? Used to describe continued physiological development. Please know this word, continued physiological development. And formation of root apex and encompasses all vital pulp therapies. Basically, the goal of this process is to allow root growth to complete. Now, what does it mean? Suppose a patient comes to you with some trauma, or if he has any caries, right? And the pulp has been exposed. Now, this patient has young permanent teeth, which means that when the trauma or the caries happened, the apex is open. But you can say that only the coronal pulp has been harmed. So you decide to go for DPC, or you decide to go for IPC, or even pulpotomy. In these cases, what happens is when you do these, there is physiological development of root, which means when you go with these modalities, the radicular pulp is safe, right? This radicular pulp will continue to grow. There is no stoppage. So that is why the definition said continued physiological development, and there is formation of root apex, right? And it encompasses all vital pulp therapy. The indication for this is root not completely formed. Obviously, there should be open apex. There should be no spontaneous pain, right? When there is no spontaneous pain, obviously, that is when we go for modalities like DPC, IPC, pulpotomy, and there should be normal radiographic appearance. The contraindications are that the radicular pulp, if it is necrosed or if there is periapical radiolucency, then in these cases we go for pulpectomy, right? So in these cases, apexogenesis is not possible. We may go for apexification in these cases like we studied in the last slide, right? So this is the difference between apexogenesis and apexification. Apexogenesis means continued physiological development. Apexification means that we have put in a barrier, right? An artificial barrier to that apex to close it. Now see this diagram here. Here you can see that there is open apex and this apex has undergone a treatment. Now we cannot judge by the radiograph which modality has been used here, but let's say pulpotomy has been done, right? This is filled with restoration. And after some time, you can see that how this apex has been closed, which means that there is physiological development of root, right? So this is a normal process and the apex has been closed, and this is apexogenesis.